The Best Docs Network helps you find some of the best doctors utilizing the latest procedures and practices in healthcare. Actual patients and the doctors themselves walk you through their stories that together help you make the best decision in your search for the right doctor. On today's episode, bariatric surgeon Dr. Scott Stowers with My Bariatric Solutions helps his patient lose weight. Learn more about the Texas Heart Institute and their doctors with interventional cardiologist Dr. Annie Varghese. And doctors from Forest Park Medical Center utilizing the latest in technology and techniques.
In order to speak or to make sound, our vocal cords need to close completely. And if one of the vocal folds is paralyzed, it's not moving in concert with the other vocal folds. And this causes problems with being able to speak and amplify and project your voice. So if the nerve that goes to one vocal fold is injured and it doesn't move as the other does, then that's considered a vocal fold paralysis.
It's affecting my job. It's affecting how I want to do to retire because I teach a lot of classes and things of that nature, and I could see that going away. I wasn't able to do that because my voice was so weak. I literally had to stop about every fourth word and take a breath because I couldn't get the words out.
After visualizing that the vocal fold was in fact paralyzed, I offered him a surgery that would help to move the vocal cord over to the midline so that the functional vocal cord could move and touch it perfectly so that every time he wanted to talk, he could have a good vocal cord vibration and be loud and be heard and be clear. Recovery is very quick. The patient is actually awake during surgery. The patient does stay in the hospital overnight for 23 hours with the drain in, and in the morning they're able to have the drain out and go home with just light activity restrictions, but no diet restrictions, no voice restrictions. Steven is doing excellent. He is able to speak to his colleagues on the phone. He's able to teach again. He's able to perform his duties at work that he's been doing for decades. So he is having a fantastic recovery, and also his swallowing has improved tremendously.
Being able to interact with people again, go with their homes, not have to worry about ambient noise and TVs and having to try to talk over that because I couldn't. Now I can. She changed my life. She gave me back something that I never hoped to have again. Been a tremendous experience for me and a life-changing one at that.
Request an appointment on bestdocsnetwork.com.
I was playing soccer professional back home in Morocco, and I broke my ankle. Then when I came to the United States, 1975, I sprained my ankle again. You know, I went to see an orthopedic doctor, and he told me that when you reach 60 or 65, you will have arthritis. It's going to get really bad. So I really didn't pay attention to him. So I said, no, this is great. I don't have no problem. The more I was playing, the more it was getting worse.
Abe came to me with chronic ankle pain and swelling for years. He used to play soccer professionally. He was told that there's not much you can do except cortisone shots and take some arthritis medications for his chronic ankle pain. I felt that he would be a good candidate for ankle joint replacement. So that's what we offered to him. When you have an arthritic joint, especially in the ankle joint, you have there's bone spurs forming all over the joint. That's what arthritis is, where cartilage is worn out, and then you have arthritis, or what we call bone spurs, forming everywhere. So we'll have to open the front of the ankle joint and go to the ankle joint. We remove those bone spurs, especially around the ankle joint, and this arthritic cartilage that you have, we actually use a saw to resect the arthritic bone and the joint from top and bottom. We remove that arthritic bone and cartilage, and we replace this two-part joint.
Now, I can kick soccer ball. I'm taking it easy though. I'm a head coach for one of the university here in Dallas. You know, in September, I'm going to start coaching again. And so that way I'll be able to demonstrate, use my foot.
After ankle surgeries, once they're recovered from their postoperative period, they're able to resume all their normal activities, including sporting activities, running, jogging, jumping. That is our goal.
I feel great. My wife, she told me, you know, I think when I died, she's going to bury the soccer ball with me in the grave.
To learn more about Forest Park Medical Center and their doctors, go to bestdocsnetwork.com.
Hi, I'm Jim Knox, and a lot of people have asked me, hey, what do you do away from the ballpark? Well, I am co-founder of a company called Identity Media Services. Our Emmy Award-winning production team can brand your company with videos, commercials, radio, and television, and our digital performance program specializes in lead generation, websites, and reputation management. So if your business needs a lift, give me a call, because as you know, it is tough to stay on top. Whew, that's gotta hurt.
I didn't feel good about myself and I never wanted to go anywhere. Now my world has opened up. I occasionally go out with my girlfriends and we have a great time together.
I was getting older and didn't really care about my weight, but my doctor said I needed to do something immediately. Now I'm spending time with my grandchildren and every moment seems special.
My one reason was to live life again.
My one reason was to simply live.
So what's your one reason?
Barker Bariatric Center. Log on or call today for your consultation.
Find your doctor on bestdocsnetwork.com.
Alex has a question for Dr. Bajaj. How have knee replacements improved?
Knee replacement surgery has really gone through a huge renaissance over the last few years. Initially, it started out with better plastics, so the knees are lasting 20 plus years now. And now what's happening is we're going into custom knee replacement parts, where instead of having 7-8 sizes and fitting a knee to those sizes, now we can actually create a knee replacement custom built for that patient based on their CAT scan or MRI scan. The reason that's important is the length of how long a knee replacement lasts, or how long a knee replacement will last, depends on how well it fits and how well it's balanced through its range of motion to make it as good as what God gave you. So we're continuing to make improvements, and now what we do is we base the knee replacement on the patient's own anatomy and are able to create that knee to fit them almost like a glove.
Ask our doctors on bestdocsnetwork.com.
At the age of 25, about 15 years ago, I was diagnosed with high blood pressure. And with that high blood pressure came 3 medications. I had a family history of heart disease and had seen a cardiologist since I was 10. Had, just a lot of weight gain with having 2 children. My grandmother had both legs amputated with diabetes. Then my father has diabetes, and just the family history.
Yeah, Lisa is an example of one of our patients that came to see me for the typical problems of inability to lose a significant amount of weight that would affect her health.
Several different doctors for 15, 20 years had been saying that, if you could lose 70 pounds and keep it off, you would get rid of the high blood pressure. There is a huge possibility that you will not be diabetic, that even your heart condition would be just almost completely resolved, and you could even get off of all of the medications. So I chose the gastric sleeve procedure, which for me was just the best choice.
For a sleeve patient, they typically need to be at least 70 pounds overweight. Sleeve is a relatively new procedure that we do where we take out about 80% of the stomach. The whole concept of the surgery is just restrictive in nature, where they essentially are on a low-calorie diet for the rest of their life, but they're not hungry all the time.
I came in, I met with the actual surgeon. I actually sat down with Dr. Stowers, and he was amazing. Somebody who just totally makes you feel comfortable. He answered every question. He was very honest with me and reassuring. It was just beyond belief that he was able to make me feel so comfortable. At 1 week post-op, I was literally off of all of my medications. It had already made that big of a difference.
Within a year, she'd lost about 80 pounds.
I've reached my goal weight. It's been great going from a size 18-20 and an extra large shirt to a size 8-10 and a medium shirt. I never thought I'd see that again, so it's been really exciting.
Request an appointment on bestdocsnetwork.com.
If you can work up a sweat for just 1 hour a week, you can reduce your risk of heart attack, improve overall mood, and lower blood pressure.
Today we're here with Dr. Reynolds Delgado at the Texas Heart Institute. He's the Director of Cardiac Transplantation at the Texas Heart, and we're so happy to have him with us. Dr. Delgado, thank you for being with us today.
Well, thank you, Annie.
Now, we know that cardiac transplantation is something that seems so far removed from most people, but really so many people are in need of this great help. And can you tell us a little bit about how you evaluate a patient for transplant?
Yes. Well, first of all, there's a lot of people that need it, as you say. Around 6 million people in the United States have heart failure, and a good proportion of those need a transplant. The problem is we only have around 2,000 donors' hearts available to us in the nation per year. So we really have to focus on those patients who can get the most out of those 2,000 donors. And so really that's the focus when we're working somebody up for transplant, finding someone who's going to live a long, healthy life after the transplant.
Exactly. Now, there are several ways of helping the patient, right, with assist devices. Would you kind of mention those for us?
Yes, and you know, the transplants are a limited resource, so we only have that limited number that we can do per year. But there are other things we can do that are not. An example is the artificial heart devices. These are known as LVADs, or left ventricular assist devices. And these are small motors, small motor pumps that are tiny, about this big, that can be implanted with a surgery in the chest, underneath the heart, and they can pump blood for the heart. And so really in a failing heart, we have other alternatives like this.
We see that there's hope for people who can't even get a transplant. They could come and be evaluated for even this assist device.
Absolutely, absolutely. There's so much we can do beyond transplant. And as for transplants, we do many of them. We did 57 in 2012. That's a lot of transplants. It's one a week. But one thing that's important for people of Houston to know is that herein, where we are standing and sitting, is the greatest med center in the world. Just right there, it's the greatest cancer hospital in the world, and here is the greatest cardiac hospital in the world. And within this med center, we can do just about anything that's doable in medicine.
That's excellent. Thank you, Dr. Delgado. We really appreciate you.
Thank you, Annie.
Coming up on the second half of today's show, vein specialist Dr. Peter Morgan discusses his methods for treating those with restless leg syndrome. Family medicine doctor Richard Honecker addresses common health concerns in our Medical Minute. Craniofacial and plastic surgeon Dr. David Jenikov talks about the personalized approach each patient receives in his practice. Oral surgeon Dr. Paul Metz reconstructs his patient's jaw, as well as more doctors from Forest Park Medical Center utilizing the latest in technology and techniques.
My legs were very, very tired. I couldn't sleep, toss and turn, couldn't get comfortable. They would just hurt, and all night for years.
Restless legs is best described as a very strong sensation or urge to move your legs. It becomes disabling because it creates an anxious sensation. It's hard to explain. You're not sure what's causing it. You just have this overwhelming urge to move your legs. It almost always occurs at night, and because of that, it creates severe insomnia and severe anxiety.
I had varicose veins. I knew I could see them on the outside. I didn't know about the veins on the inside that were not allowing the blood flow to go past my knees. That would just go up so far and then just go back down to my feet.
We mapped her veins very carefully using ultrasound. We again isolated all the bad veins, the ones that were too large and the blood was running backwards because the valves had failed. And then we selectively ablated those using radiofrequency under ultrasound guidance.
No pain, just a little stinging when they first go in with it, but really not much, even though they say, well, it's not gonna hurt, it's not gonna hurt, but it really didn't. The last treatment I had, I didn't feel a thing.
And we do that without any incisions or anesthesia. The patients can walk in, sit down, have the procedures done, stand up, walk out, get in their car, and drive themselves home.
I would say don't worry about it, just do it. Just get it done because you need to have it taken care of. Sleeping now, I rest comfortably, and it turned out good.
In the past, we used surgical procedures. Problems with that: one, it required general anesthetic. Two, it required big cuts with potential side effects like infection, damage to nerves, arteries, muscle, and they weren't selective. We were almost randomly choosing veins to treat, and they weren't always the only or maybe even the correct veins to treat. Now we selectively treat only the veins that are running backwards, so it works much better.
Find your doctor on bestdocsnetwork.com.
And we are excited to have in the Best Docs Network studio Dr. David Genachove. He is the owner and director of the Genachove Plastic Surgery Group, one of the best plastic surgeons in the state of Texas, and operates right here in the Dallas-Fort Worth area. Dr. Genachove, welcome to the program.
Thank you, Jim.
All right, Dr. Genachove, what can a patient expect when they have a procedure with you?
When someone comes to our office, we have folks who've been with us for now almost 17 years, and consistency in care is something that we really think is important for our patients. We take personal care of our patients, physicians, our PAs, our physician assistants, our nurses, our medical assistants are all there to help our patients. And so we kind of take, as I say, a grandmotherly approach. We see them often. We see them after surgery. We talk to them before surgery. We have an open office for our patients, so if they think they need to come in, they're more than happy to come in. Additionally, in some of our patients after surgery, they really have a hard time getting out of bed or getting to the office, and we make house calls when we're able to do that, because some of our patients either live alone or they are older and getting transportation is difficult, so we'll go out there and see them. Additionally, we have them operated on at Forest Park Medical Center in Dallas, Frisco, or Southlake, and there's no better place to have an operation. So our goal is to treat every single patient as if they were a member of our family. And we wouldn't do anything on any of our patients that we wouldn't do on members of our own family.
Good point. And I know this has happened. Someone's told me this, that actually after you fix the face, they come back in and say, hey, can you do something to my body? What do you tell them?
Well, fortunately, in our practice at Genachove Plastic Surgery Group, there's 3 surgeons. And everyone has kind of a unique skill set. We're all basically trained very similarly. We all have cleft and craniofacial reconstructive plastic surgery training, but additionally, one of the guys has more of a breast focus.
To see the rest of this interview, as well as other outstanding videos, head to bestdocsnetwork.com.
Taking a multivitamin is a quick and easy way to make sure you're consuming the essential vitamins and minerals you may not be getting from food. Make sure your supplement delivers 400 IU of vitamin D, which is the dose that is said to reduce risk of early death by 7%.
Doctors used to prescribe hormones for all menopausal women. We thought it was good for their symptoms, and we thought it also prevented heart disease. Well, we were wrong. Studies about 8 or 10 years ago showed us that it really might increase the risk of heart attack and stroke and breast cancer. However, don't be afraid of hormones for short-term and small doses, especially if you have 3 of those important menopausal symptoms. And those are moodiness, hot flashes, and vaginal dryness. If theirs are mild and don't bother you too much, don't worry about it. However, if they're severe, it will not hurt you to go on hormone replacement therapy for just a little bit of time. You can do it for a year or 2 at medium to low doses, and if that doesn't work, you can use higher doses. Generally, you're just trying to get over that hump of those symptoms, so there's no reason to suffer that way. Now, if you've had certain kinds of breast cancer, hormone replacement therapy is not going to be for you at all, no matter how you feel. So you'll just have to stay away from it in that case. But in general, if you have those big 3, hot flashes, vaginal dryness, or moodiness, hormone replacement may help you and those people around you.
Marie has a question for Dr. Renee Leone. Is it safe to take allergy medications during pregnancy?
The answer to that is both yes and no. There are a set group of medications that have been studied extensively and have been used for many years in this country in patients who are pregnant. It's really important that the physician and the patient are well educated and understand what is safe and what is not safe. Especially in asthmatic patients, there's always been this theory by many physicians and some patients not to take any medications, especially during pregnancy if they have asthma. Quite the contrary, it is so important for the fetus that mom have well-controlled asthma and that they take their medications to promote adequate oxygenation to the fetus. You need to speak to your physician and or your specialist who's taking care of your allergies and asthma to ensure that the medications are safe and to make sure that the patient feels comfortable taking those medications during pregnancy.
Ask our doctors on bestdocsnetwork.com.
I had tried many different diets. I had been to different weight loss doctors and I had tried different weight loss medications, and I would always lose a little, but then I would gain back what I lost plus another 20 to 30 pounds. I am a mom of 2 young children. I have a 7-year-old daughter and a 3-year-old son, and I just didn't have the energy or want to do, active things with them. I was just tired. And so I finally woke up one day and decided that I had to do something about it because things weren't getting better.
Katie's BMI was around 35, so she wanted something that wouldn't be too aggressive in terms of an operation requiring a long recovery and things of that sort. And she wanted something that wouldn't also affect her lifestyle too much, where she would have to come back for fills and things of that sort. And so we settled on a sleeve gastrectomy.
When I was getting ready for the procedure, I was just so excited. I couldn't wait for the day that my surgery came because I was at my absolute heaviest.
The sleeve gastrectomy is done by performing multiple small incisions on the abdominal wall. They're usually about 1.5 to 2 centimeters. Once inside the abdomen, you identify the stomach. You free it up of scar tissue if there are any, and then you divide it over a tube called a bougie that tells you about how big you want the remnant stomach, the stomach you leave within the body, to be. The stomach that's left behind is a smaller size.
After surgery, within the first week, I had dropped 12 pounds. The weight was coming off at about 3 to 4 pounds a week. I still get to eat all the things that I'm craving or wanting, but I just eat a lot smaller portions. I feel like I can go hang out with friends more. I actually have been going to the lake with my family. I don't feel embarrassed to put on a swimsuit anymore.
To learn more about Forest Park Medical Center and their doctors, go to bestdocsnetwork.com.
At
External counterpulsation. What is that? It's otherwise known as ECP therapy, and it's a fabulous way of helping grow coronary arteries, renewing the blood flow to the heart when many times that blood flow has failed because of coronary blockage. Many patients are affected by coronary artery disease or plaque involving the arteries to the heart, and the blood flow diminishes, and sometimes people have heart attack. So the way that we can fix this is by placing a stent or doing angioplasty to those arteries. Sometimes we have to send patients for surgery, for bypass surgery, to help renew the blood flow to the heart. But there are many patients who are not candidates for either one of those, and they can only take medications. But now we have something called ECP therapy, external counterpulsation, where the patient lays on a bed for 1 hour treatment with massage therapy to the legs, which improves blood flow to the heart. It's time to the cardiac cycle. With that therapy, 5 days a week for 7 weeks, patients can really experience improved blood flow, improved energy, improved symptomatology. It's just an amazing way of increasing blood flow to the heart. Ask your doctor about ECP. It's great.
Sunflower seeds can help protect your heart. Consuming a 1/4 cup of these seeds delivers half of your daily value of vitamin E. Vitamin E helps keep your heart healthy and fights infections.
Watch more videos on bestdocsnetwork.com.
The ideal patients for dental implants are ones that have been through lots of restorative procedures, and where these procedures that just aren't predictable. And so we were able to give them their 3rd set of teeth with the use of dental implants.
I had an accident when I was 10 years old, and I fell down on my face, and I dislocated my jaw. And I didn't know that then, but I started looking for the oldest doctor or the one with 35 years or more of experience. So I went to the facility in Gessner, and I saw Dr. Metz, and they said, this is the guy who's gonna have to be working on you. I had to decide if I wanted to go through with it, and I did research. He graduated top in the class.
So in Tico, we were able to move his upper jaw forward and set his lower jaw back so as to help line up his skeleton so that his teeth meshed together well. We, as specialists in oral surgery, are uniquely qualified to provide these procedures.
I just figured out this is the best facility, this is the best doctor, and I truly believe that, Dr. Metz and his team, they know what they're doing.
These patients, when they come down the hallway, when we see them after this procedure, we see their level of confidence has gone up tremendously. We can tell by the smile on their face as well as their dress. They're dressed sharply and they're holding their chin up. You can certainly tell that they are happier individuals afterwards. Technology today has really revolutionized how we practice implant dentistry. We have cone beam CTs, which allow us to take a CT of the patient in the office, and in about 20 seconds, we have 360 degrees of bone around the implant. So we know ahead of time whether we need to graft and also the type of grafting that we need to do ahead of time. So patients are better prepared for the experience and know more what to expect afterwards. We're able to do this in a safer fashion. And it's much more rapid. The procedures are much more rapid, and the recovery is much easier as well.
Watch more videos on bestdocsnetwork.com. Didn't find the doctor you're looking for on today's episode? Head to our website, bestdocsnetwork.com. There you can search our video library by topic, specialty, and doctor. The Best Docs Network, helping you find the right doctor and bringing medical education to you.